What are peptides and why does everyone on the internet want you to use them? I'm Nick Angelis. This is the Ascend Health Show. I'm the owner of Ascend Health Center in Fairlawn. And to answer that question I just asked, I have Angela and Dr. Krkic from Zeal Vitality. How are you guys doing today?
I'm good. How are you guys?
Very good.
Yeah.
So no one knows this, but this is actually our second show today.
Yeah.
And we accidentally talked about this a little bit.
Yeah.
But we can carry on from where we left off. It'll confuse everybody in the audience, and that's kind of what the show is for.
That's all right.
Just puzzling people, me rambling, you cutting me off when you have something to say, since I'm mostly here to pick your brains and vice versa.
Awesome.
Yeah.
So most people think of peptides as GLP-1s. Hey, I can finally lose some weight, and maybe
Yeah.
I can still have cookies.
Yeah.
But there's a lot more to it. I guess we can talk about that a little bit. There is another show I've done with KMI Wellness. They're in Burton and Streetsboro about some of this weight loss. Because I always hate, you'd think after 64 shows or so, I would repeat myself.
Sure.
But talk a little bit about the GLP-1s and then some of the other things that peptides do.
So peptides are small amino acid chains that our body already has. Insulin's a peptide, the GLP-1s are peptides. They are signaling molecule chemicals telling your body to do something.
Mm-hmm.
So we have seen with our patients some awesome things come out of GLP-1s. One of them is food noise. Obviously, they're able to lose a little bit of weight. Inflammation is a big thing. I think that most of our patients see right away that they have an improvement in inflammation. Mm-hmm. So joint pain, of course, when you're losing weight, like they start to have less problems or pain.
Okay. And inflammation, I mean, if I had to say one thing that Ascend Health Center treats, it probably is inflammation.
Yeah.
Typically neuroinflammation resulting in anxiety and depression,
Sure.
but a lot of our treatments, even the TMS, transcranial magnetic stimulation, which is an electromagnet that stimulates your neurons, it helps with depression. It can overstimulate them to help with anxiety or OCD, but often the root cause is inflammation. Not
Yeah.
always, because depression is very
Sure.
complex and it can have a variety of causes, but
Right.
particularly for that subset,
Yeah.
it's almost 100% of
I
patients.
know,
will get
inflammation
better,
is like the start of chronic disease, right? Like, so all of Americans, we have like this chronic disease state that most of us are in. And typically it's from diet and stress, but those things cause the inflammation, which ends up causing other problems. So peptides are really great. There's a lot of peptides that are helping with inflammation.
Okay.
GLP-1s is just the one that I think everybody knows about right now, but we're learning more and more on different peptides to do different things. So,
Sure.
yeah.
And I am familiar with peptides, but I tried not to remember any of that for the show because
Yeah.
then you'll have me talking about it with my amateur version of
It's
what
a
I know.
lot. It's a lot to know. Dr. K's like the peptide guru. Like he knows the ins and outs. He's definitely into it, been using them. So he's a great resource.
Yeah, it's amazing when you say to a patient that I'm like the guinea pig for what I've tried to give you. So
Yeah.
it's like I'm experimenting on myself
Yeah,
first before
sure.
I give it to anybody else. But you know, peptides are probably one of the easiest, safest things that you can controllably inject in your body.
Right.
With supervision, obviously, we teach patients how to actually do a subcutaneous injection
Sure.
with a little insulin syringe needle. And they're already something that your body, God has created in your body. So these are sequences. Most individuals are not going to have any symptoms other than maybe a little, where we put the
Sting.
or sometimes, you know, you're pushing fluid under a little bit of fat. Sometimes it swells up a little bit, or you get a little erythema, a little rash, or not a rash, but like redness. in the
Irritation,
area.
yeah.
So
Okay.
they're super, super safe. And I love them personally because we're kind of in this world of optimizing
Yeah.
your body. It's kind of like,
Right.
you've heard of the word biohacking. Biohacking now is like
Sure.
it's a fun thing because people are experimenting. It's important to experiment with good quality products. So
Right.
Yeah.
before you, get something from China that
Right.
doesn't have standards of
Absolutely.
sterility and safety.
Absolutely. Regenerative medicine is the future.
Yeah.
So, you know, we're trying to learn as much as we can about all of the peptides that are on the market, obviously, and get them into our patients' hands safely so that we can help regenerate and repair your tears or your meniscus or your rotate, like try to prevent some of the
Right.
surgery, right? So get you out of pain, get rid of some of the inflammation and regenerate your own healing.
Yeah, well, you guys mentioned inflammation. So there are a lot of ways we can monitor inflammation. C-reactive protein in the body to see exactly how much inflammation do you have in your body. But it's interesting, I just recently learned, I don't know if you know this, galactin-3 is it's a protein, a carbohydrate binding protein that's actually released in the bloodstream, and you can be measuring inflammation systemically, but you can also measure inflammation in the brain, Nick.
Okay.
So when we were talking about mental health,
Right.
there is amazing research now, and it's easily accessible. Galactin-3 can be measured, and you can see what you're doing to your brain. Even
Right.
It was interesting. A doctor mentioned at a conference I was just in on this past weekend that even some of the athletes that are overtraining are risking galactin-3 increase, and their mental health declines because of neural inflammation. Measuring the microglial cells, the immune cells of your brain, and I thought it was like mind-blowing that overtraining, doing something too much can increase systemic inflammation.
Well, when I started Ascend, one of my thoughts was J.R. Smith needs what we have here. He was on the Cleveland Cavaliers. He was nuts all the time.
He was pretty much burning out.
But you'll see that where the physical abilities does not match the emotional maturity of these players. And that is a risk often with biohacking, is that you're trying to do so much for your body.
Right.
And you're focusing so much on, I need to be in perfect health, that your mental health is deteriorating because of that obsession. So rather ironic. But I mean, speaking of irony, so are injecting a GLP-1, when you think of all the medicines that you can inject to sort of suppress your immune system. I mean, that's really the only part of pharma that's growing right now.
Yeah.
I mean, I was on Tremfya myself, injecting myself every 6 weeks so I could work in a hospital without breaking out.
That's wild.
And it is something too in that realm of pharmacologics where I often tell patients, especially when they have autoimmune issues, no, try some natural things, go to a place like Zeal, and sometimes you can cycle through. Every few years, they'll come up with some new drugs that may help you, and then you may realize, nope, standard American healthcare still is doing nothing for me. Go back to a more functional approach. So I think that's an important thing for our patients to learn too, is that your philosophy of health doesn't matter, meaning that whatever works and makes you feel better and your labs are better, that's what you need to go with.
Absolutely.
So if it's going to your doctor and you pay a $20 copay and they see you for 5 minutes and you're better, amazing.
Yeah.
If it means you need to go to a place like Ascend or Zeal where we'll spend more time with you, and some things may be, in our case, some things may be covered by insurance, some things are self-pay. You know, it all depends on what results are we getting.
Right.
Sure.
Yeah.
Otherwise, again, you're doing what I do, where I get a terrible Groupon. I'm like, I have a discount, but this food is terrible.
Right, yeah. So I love that about not being in the insurance model, because we don't have these regulations and time constraints that we have to kind of like follow when we're in that type of healthcare. So it really changes things when you like have that time. So there's no rush, and you really get to know them, your patient. And yeah, you're exactly right? Like you can see your primary care and bring me labs that are going to be covered with your insurance. If they're not covered with us, whatever we have to do to get you better or feeling better. But
that is kind of our philosophy at Ascend. So a lot of times patients will like their therapist or their psychiatrist, but they need to get better. So we operate more as a referral place, which is of course why I do all these shows where you can stay with the person you like. We'll also help you get better. They're still in charge of you, but so we can help them and get you over this hump or whatever. And it helps it also be a more temporary relationship. So the problem with health is that as you get sicker and sicker, you add more and more specialists. And then over time, all of your effort, all of your time, all of your thoughts are related to your health. So even if you did get better physically, the mental fortitude that you need to get through the day and be healthy, and wait, am I sadder? Wait, are my joints hurting more? Do I need this? Like, people end up a mess, even if we've actually cured the physical issue.
Yeah, because their job has been now being sick, right? And going to appointments, and that becomes their reality. That's their perception. And
it's their identity of being taken care of by others. So, and that's something that we struggle with at Ascend. So sometimes we'll deal with it where, especially, we don't do very many pediatrics, but you asked me about that earlier. So sometimes we'll do a very targeted approach. And we'll time it with the end of summer break, or Christmas is coming, or your family's going on vacation. So we'll give you all this attention, we'll try all these things, and then we let you free so that you don't become an adult who's so used to the healthcare system that any issue and you're off to see your doctor.
Yeah, and I think that's like what I love about us is we're becoming a community for our patients. So whether it's with us, like with you referring out, or just putting them in front of like our other providers, right? You know, I can say something, but if they hear it from Dr. K, it's different. Or if they hear it from Dr. Amanda, it's different.
Yeah.
So it's really nice to have all of us in like the same area so that we can work together and they're getting the best out of all of us.
Right.
Yeah, that's important to note because it is one of those things. Somebody might connect with you, Nick, much better than they connect with us too, or somebody.
And they might not. That's another reason for this show. They can be like, nope, don't like him. Great, we save all of us save some time.
Yeah,
Sure.
And it's okay. I mean, we can't please everyone, but it's almost important to know that if you are willing to be helped, and you're looking for a relationship with somebody that is willing to help you, then it's like magic.
Yeah.
It's like the compliance goes up with patients. It's easier on the practitioner, and you don't have to. We don't have to work so hard, and the patient doesn't have to work so hard when there's that trust component in it. And then with peptides, regenerative medicine, with biohacking, there's some really amazing tools that we can use out there because we're all aging. We can't avoid death.
Yeah.
It's just how do we spend time statistically in America? Most people in their late life, in their final years, final quarter of the sprint, are going to have risk to develop Alzheimer's disease, Parkinson's disease, dementia. It was interesting, a big study just was released at the A4M convention that they took Microsoft, I don't know how it was involved, but it was pretty big. They asked AI and all the data that Microsoft held and social media platforms, what are people searching the most right now if they're under the age of 50? And it was interesting fact. People are researching how to avoid dementia. It was the top research because what's happening right now, we've never seen dementia this prevalent in people over 40. I mean, people developing dementia over 40 from long COVID, their immune system wasn't functioning really well. And it's amazing to see, yes, we're waking up because that's important. You might be in your 40s, you have parents that you're taking care of right now, and it's like so detrimental to see your loved one that took care of you. Now you have to wipe their butts, take care of for them. And it scares the crap out of me. I'm like, I don't want to do this for my kids.
No.
Yeah.
I don't want my kids to take care of me.
And a lot of it is cellular aging. So I do a lot of anesthetic work with colonoscopies, endoscopies. There's a huge increase in colon cancer in people my age. And they finally cracked some of the code saying, nope, because of our lifestyles, because of the way we eat, all of our cells are aging quickly. So that's why we're seeing colon cancer in 30-year-olds that we normally see in 70-year-olds. So it's probably similar for dementia.
Absolutely.
And this is still related to peptides because that's what they are. They're anti-aging compounds in a lot of cases.
Yeah, your body's producing them when we're young and we're in our 20s. Like, we're healthy, we're active, like we can recover quicker. Obviously, we're getting older, everything slows down. And I think the dementia thing, I mean, there's all these new statistics out there that like 70% of women in my age group will have dementia or Alzheimer's.
Crazy.
So it's a big part of our reality as we're getting older and we're seeing it even more so now. So it's scary,
Well, which peptides help with that in particular? And as a disclaimer, again, don't go buy this off the internet. Everything we talk about, ketamines and regenerative medicine.
Come and see us. We'll clear you medically.
None of this really works if you go to some online pharmacy and do it yourself. Like, there's no Groupon. If it works well, then you need a professional. If it doesn't work well, you're wasting your money anyways. So that's my quick little disclaimer there.
Yeah, I mean, Nick, what are some of the things that you can do? There's a lot of things, even just like talking about growth hormone. So what is growth hormone? It's a hormone that we have abundance when we are young. That's why we recover. Your child falls at 5 years old, next thing you know, their bruise is gone. But each decade, growth hormone declines by 15%. So let's do some math. Like by the time you're 40, you're at 60% decline of growth hormone. So all your recovery systems are dampened down. So peptides, like there's a peptide called tesamorelin, which is a growth hormone analog, growth hormone releasing peptide. There is peptides such as sermorelin, CJC ipamorelin, CJC 1295. Have you heard of these before? Yeah. So these are all peptides that stimulate natural growth hormone. Now, we can relate that to the decreasing dementia risk just by that, because growth hormone is going to cause better sleep. better recovery of your muscles.
Less
You'll have
inflammation.
less inflammation.
Yeah.
When you sleep better, your brain recovers.
Right. Yeah.
Absolutely.
So there's so many components that these peptides will do, streamlined, down the stream, because it's not just, okay, you take a
Right
growth
now.
hormone releasing peptide and
Yeah.
all of a sudden, you'll have all these benefits. But down the stream, give them some time. Minimum of 3 months of utilizing these peptides, we'll start seeing really some amazing results.
These peptides are so small, they're able to get across like your cellular membrane. So we're able to like really target different parts of your cellular function.
Yeah.
So I think that that's what we lack with like typical standardized medicine. We can't get to that cellular level. So that's where the peptides are really awesome.
Well, think of the pills that help you with toenail fungus.
Yeah.
They'll destroy your liver in the process because it takes so much medicine to get to that point you need it.
Right.
So, I mean, that's the way we use ketamine. It releases glutamate in the brain. It can be a neuroinflammatory neurotransmitter, but it's basically repurposing what the body's already making. This leads to like BDNF or releasing neurotropic factors. There's a lot of, and peptides are the same way, where they start a chain reaction that the body then completes. Which is important, I feel, because when you use these type of methods, the body takes over. It's the opposite of what you see sometimes with poorly done hormone replacement, or a lot of medicines like benzodiazepines, stimulants, opioids, where the body's like, oh, you're going to do this for me? That's fine. I don't need to do anything.
Right, we're going to shut off now.
Right.
Yeah,
It's
and you
very
lose that
difficult to
function.
restart that.
Yeah, you can never really restart it after it's turned off like that. I think I really like GHKCU. It's another peptide. You know, all of the women in my age group were all getting Botox and the lasers and the resurfacing and the hyperpigmentation. Like, we're vain, right? So we're paying all this money, but this peptide is kind of what reboots your collagen level and helps with your hair, skin, and nails, and hyperpigmentation and fine lines and wrinkles. Like, it's not like a miracle, but I mean, it's something that we can do to prevent our aging on the outside a little bit. So not only are we regenerative and healing your tears and, you know, from our old age, but we can try to, you know, make you look good and feel good too. So I think there's just so many awesome things with peptides.
Yeah.
And I just thought of this. Does it help at all? So if a patient's like, well, I wonder if peptides would help me. Is there any connection where they could start, for example, in our office, we use some glycine, we use a lot of amino acids because some of them are very useful, taurine in some cases. Is that like a baby step, or is it just not really relevant since peptides are so more complex than just an individual amino acid?
I feel like we're dealing individually with patients, so we can go slow.
Yeah. I mean, there's so many like nutrients. There are nutraceuticals that can be cohesive in like actually helping the peptide work better. So it's not the fix. It's not like one injection is going to fix it all. So if you're not providing the food for your cells, no matter what peptide you're signaling, the cell doesn't have the energy to do this function. So it is cellular level medicine.
Is that how you use, like I know you all do some IV nutrition therapy. Is that part of it? Like, let's get you the actual nutrition so you can...
Definitely. That's where we spend a lot of time on like lifestyle changes, like what our expectations are like for protein intake, because we want these things that we're adding into your lifestyle, whether they're peptides, GLP-1s, nutraceuticals, supplements. We want a hormone replacement therapy. Whatever we're doing, your body has to be ready for that peptide, that treatment. So if we're fueling our body with just junk or dehydrated, we're just going to be like kind of banging against our head, like the wall. We're not going to see the results. A lot of women have thyroid issues, underlying thyroid issues, and they can't lose weight, but their standard doctor isn't looking at all of their lab work, or we add hormone replacement therapy in, but your thyroid isn't functioning, so we're not getting the results that we need. So we do have to look at you like cohesively, and there are times that we have to say you're not going to get results until we fix this other issue.
I personally love IV. I mean, I travel. When I travel, I get an IV before I go. So that tells you it's very important, because you're going to be exposed to new viruses. You're going to be exposed to dehydration, altitude if you're traveling in the airplane. So your IV therapy is amazing. You don't have to go to the hospital anymore to obtain an IV.
No.
your IV at the hospital is going to cost you $3,500.
Exactly.
And so now you can
and you probably have to talk to your insurance company at some
to
point
approve
for 10
it.
years.
And so like we do some vitamin C in our IVs.
A lot of
are-
immunity,
so
like
great.
zinc, B12.
Yeah.
We have like a glow one, a migraine one.
Okay.
Yeah, with magnesium.
Yeah.
Great.
So it's really a quick way at getting the nutrients in and preventing the dehydration. So
And I think, so we do some IV vitamins at our clinic. A lot of times it is for patients who are doing the ketamine infusions, where I can tell maybe they had an eating disorder or some issue where I'm like, the ketamine works by lighting up parts of your brain that aren't usually active, but that's also going to require some vitamins and nutrients to get the most out of it. And there are some patients where I feel it is a gimmick, like, oh, this won't do anything for you.
Right.
Or like, well, we'll try it once. You feel better? No? Okay, forget it.
Forget it.
So I think that is one of the advantages of having a lot of different options, is that so you don't have to, it's not, oh, every patient is a nail and this is a hammer and this is what we do here.
Yeah.
So especially with IV, it is controversial in some cases, but again, it often speaks for itself.
it really does. I mean, I had an immunity boost. Like I was getting sick. We did it and I was fine,
Zinc
like
and
literally the
vitamin
next
C.
day. Like I was like, okay, I feel so much better.
Right.
Sometimes you just need a rinse out. Nobody drinks enough water. We never drink enough. We gotta like kind of rinse out a little bit. So
And it often is the electrolyte, so that is the
Yep.
one advantage of IV fluids that
Yeah.
I've had patients like, no, I'm drinking so much water. I'm like, yeah, you
Still not
don't have any
hydrating.
potassium or
Yeah.
sodium or anything left
You're
that
completely
we need for
dehydrated.
all of
Yeah.
these cellular functions that will make your brain feel
And
better.
that's what I see on most lab work, really, at our office, because a lot of our patients are pretty healthy. It's a dehydration thing, so you're just not getting enough water. So it's like when you can see it in black and white, it's pretty awesome.
I mean, who wouldn't concentrate on water when it's 70% of your body?
Yeah,
It's like, we
it's
need
like
it.
we need it, but they don't understand,
Yeah. Do you have any other lifestyle hacks? Like we just mentioned, drink more water, occasional IVs. Because what I believe in a lot of times is also having a kit. So just listening to a podcast about mast cell activation syndrome. And one of the things they said is like, no, you have your kit. You have your cromolyn, you have your H1, H2 antagonist. So when you feel something coming, you prepare for it.
Yeah.
And then it's not like, oh, I need to go to the ER. Oh no, I'm having a flare.
Yeah.
So it takes some work, but in a lot of cases, especially with complex diseases, if we can teach patients how to prepare your kit, so to speak, that helps a lot of problems be minor
agree.
inconveniences instead of
agree.
sudden emergencies. Sort of like you get your oil changed when you're supposed to in your car.
I feel like my biggest thing is like your sugar intake. We don't realize how much sugar we're taking in and how detrimental it is. So if you can just like cut that Starbucks out or make one small change, it can really lead to big steps.
Right.
So just every day at a time, one step at a time, little changes lead to big results.
And that's not controversial either.
No.
Like there's conversations like, oh, is this fat good for you? Is this a healthy? But everyone knows too much sugar bad.
Too much
You don't
sugar,
have to
bad,
research it.
easy. Yeah, like there's enough info out there. Yeah,
Yeah, you shouldn't don't feed your kids before the age of 5 any sort of like artificial sugars, like cane sugar, like sucrose, all the oses. And if it's one main ingredient is sugar, don't feed it to them. So like one of my favorite hacks in the world is really your nervous system. If you don't regulate your nervous system and modulate your nervous system, it listens. Every cell listens to your nervous system. It's kind of like the code in your brain. You can't separate the brain from your body. You can't. The thoughts are the language of your brain. I love this. Your feelings is the language of your body. When your body continues in the feeling stage, you have no control.
Yeah, you have more neurons in your gut than you do in your brain.
Well, they talk to each other. And for me, I think for health-wise, if you can go and meditate, and try. I mean, heck, it's just practicing. Meditation, it can down-regulate your nervous system, so you're not staying in that sympathetic nervous system. So next time you're driving and somebody flicks you off, you don't have to fight that battle.
Right.
Yeah.
You stay in your state of calm and collected, because every cell is going to listen to that. So like intentions for the day, setting your intentions, starting with gratitude is one of my favorite new things, is I will say all the things first thing in the morning, what am I grateful for?
Right.
And if you have never tried that before, Nick, just say random things. I'm grateful for having a cup of water, because you're going to run out of ideas eventually. Grateful for this hot water that's just like soaking me and washing me this morning. Your cells will listen to that thought, and amazing things will just unveil themselves throughout the day. So
Because if you think about it, no one makes money off of you if you're content.
Right.
So everything in our culture is meant to make you outraged or
stress
impulsive,
level.
right.
Yeah.
very impulsive.
Yeah.
And consumptive. Like we are a society of consumption, and somebody has tapped into that so well that I laugh at it now because I see it everywhere. Oh, that was a thought of somebody for me to purchase that.
Yeah.
Right.
I'm just going to say no.
Yeah.
And it feels so good.
Yeah,
to
because
have
it's
that
almost
control.
like how you're not supposed to go shopping when you're hungry.
Oh,
Right.
absolutely.
A lot of times I try to get patients in our clinic before they're desperate. I was like, look, this will cost you less money, less visits, if we can capture this before you're desperate. Because of course, we'll pull out all the stops, we'll try to fix you, but
Yeah.
a lot of times I try to think of that way, like, because some of the things we do, ketamine infusions, Spravato, the patients can't, we try to get them so they can go farther and farther without a
Right.
treatment. And it is a case of, no, if we can get you content, then sometimes the analogy I use all the time, unfortunately probably many times on the show too, is you have a chocolate cake in your fridge and you're not on a diet. You're not obsessed about it.
Yeah. You can walk
And
past it.
Exactly. So teaching that contentment
Yeah.
is so helpful. And sometimes we teach it by, oh, you could get better if you could do this, but it's the holidays, it's kind of busy, just come back in the new year.
Yeah.
And there's
That's
like a
amazing.
freedom for the patients to realize, this really doesn't fit my schedule. So not the idea of like suppressing your health, but being in charge of it. Because I'm not in survival mode. I need to spend more time with my kids instead of this appointment.
Yeah.
So just that
amazing.
ability to kind of take control is just so empowering, I feel.
It is. It really is.
So we're almost out of time again. Again, Ascend Health Center, we're in Fairlawn. We do psychiatry, some pain management. We have therapists, nurse practitioners, me as a nurse anesthetist. Zeal now to be in Hudson. You're opening up in Fairlawn, you're in Talmadge.
And Talmadge, yeah. Direct primary care,
Yep.
saunas, cold plunges, chiropractic, acupuncture. We kind of have everything in one spot,
Yeah.
man.
Amazing. Well, thanks so much for being on
Yeah,
the
thanks
show.
for
Nick.
having
We
us.
appreciate
It
it.
was fun.
Absolutely.
You are watching WCTV, Wadsworth Community Television.